Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Get CME for this episode by clicking on the CME link in the show notes. Today, we welcome Jessica Singh and Lorenzo Norris. Jessica is an emergency physician. Lorenzo is a psychiatrist, and together they co-wrote the Kevin MD article, Doctors and Nurses Are Dying by Suicide as America's Healthcare Workers Call for Change. Jessica and Lorenzo, welcome to the show.
Thank you, Kevin.
So I'm going to ask each of you just to briefly share your stories and journeys to where you are today. Jessica, why don't you go first?
So I trained and practiced as an emergency medicine physician. I had the opportunity to practice in the community after residency and then to do the first physician wellness fellowship out at Stanford. That was the first time I really got to understand the systems drivers of burnout and how much really needs to go into making the healthcare environment more conducive for both provider well-being and for patient safety. And so after fellowship, I had transitioned careers to be able to pursue that more through consulting and coaching.
Fantastic, Jessica. And I've never actually heard of a physician wellness fellowship. So tell us more about that.
It was amazing. It was the first one. So Dr. Rebecca Smith-Coggins and Dr. Corey Poffenberger out at Stanford, they created a one-year physician wellness fellowship where you worked half-time as an attending in the emergency room and the other half-time was devoted to fellowship. In the fellowship, there were journal clubs, book clubs, didactic activities, process improvement, which was so important because how much of workflow well-being doesn't involve our processes, and research. It was a really wonderful opportunity.
And how many were you that were taking this fellowship?
One.
Yeah, fantastic. So the fact that we need a physician wellness fellowship, what does that say about our current healthcare system?
That they're changing, that this fellowship is possible, and hopefully more will have it.
Excellent. All right, Lorenzo, tell us your story and journey to where you are today.
Okay, I'm glad to be here, Kevin. First and foremost, born and bred in Cleveland, Ohio. So I am a psychiatrist by training, a consult liaison psychiatrist, and I've held a lot of different roles. I've been a medical director of psychiatric behavioral services. Currently, I am the chief wellness officer for the GW Medical Enterprise, and I'm also an associate dean of student affairs and administration. And maybe to one of your earlier points, Kevin, I did not initially start out in any way, shape, or form seeking to become a chief wellness officer. But what occurred was our Dean Bass at the GW School of Medicine in the midst of the COVID pandemic, when we were looking at the well-being of our residents, it was not good as it is for many of healthcare professionals. So that's when we kind of dusted off an old plan and said, all right, let's see what we can do with it. So it's interesting. I had no ambition to become a chief wellness officer, but the state of our healthcare professional well-being, our system is really, whether it's fellowships or whether it's new initiatives or things of that nature, it is needed.
So Lorenzo, you said during the pandemic, the well-being of your residents wasn't good. What were you seeing?
I was seeing, if you will, the same drivers that we see: overwork, administrative bureaucracy. But in addition to that, Kevin, with COVID, we had isolation, we had loneliness, we had a whole generation of healthcare professionals, particularly in different states in terms of their training, whether it's UME, and when I say health professionals, I mean all my colleagues, nursing, PA, PT, OT, everybody, anyone associated with healthcare, residents, as well as I would include, for lack of a better word, junior staff and faculty members. They were affected by this, but if everyone goes back to COVID, it was a very lonely place. So we think a lot about the loneliness, the strain, and I still remember about this: you're heroes, you're this, you're that. We'd see this, and my kids would be like, "Dad, they're applauding for you," and I was like, "That's great, but I'd actually rather have PPE." It's that double-edged sword of, like, and actually there's been a lot of pushback, as I'm sure probably people who listen to your podcast or your blog realize that people just want to do their job and have purpose in it and not be considered heroes. So hero, lonely, incredible amounts of stress, training that has been impossibly changed, as well as everything else that's happened with COVID, already made an impossibly challenging situation even more challenging and difficult and outright worse.
Now, both of you talk more about this issue in your Kevin MD article. It's titled Doctors and Nurses Are Dying by Suicide as America's Healthcare Workers Call for Change. Now, Jessica, how did this article come together?
Honestly and organically, it came together. So I had the pleasure of actually meeting Lorenzo through LinkedIn. That's how this collaboration started, which was unbelievable. And I had heard Corey Feist speak at the Virginia Patient Safety Summit
Hmm.
back, I think it was in 2021. And the year that COVID came, that was the year of my fellowship as well. And I just remember going through training and then practice environments and being in environments where physicians had died by suicide.
Hmm.
And it was just one of those, what is being done? And then to learn about the Dr. Lorna Breen Heroes Foundation and to figure out that now this is actually going to the federal government and they're taking action to make change. Yes, it's way overdue. And yes, way more is needed, as we talk about in the article. There needs to be more expansion of these efforts.
Hmm.
And one of the big thing is not just to focus on mental health, but to focus on operations and systems changes to make it a more conducive environment to practice medicine. And like Lorenzo said, have that meaning and have that fulfillment. And so we had the pleasure of speaking with Corey Feist, and having his insight on the impact of this article. And it really just felt like such a tribute to, it was such an honor just to collaborate to increase advocacy and raise awareness of these issues.
And Jessica, I've had Corey on this podcast before, so I know his story and Dr. Lorna Breen's story. So for those who aren't familiar, tell us who Dr. Lorna Breen was and tell us a little bit more about the Dr. Lorna Breen Heroes Foundation.
I will try to do them justice. So Dr. Lorna Breen was a physician who practiced as the medical director of the emergency department. She was at New York Presbyterian Allen Hospital. And unfortunately, she had contracted COVID while caring for patients. And unexpectedly, she had died by suicide. And so she didn't have any mental health issues that anybody knew about. And really, her sister and her brother-in-law, they heard the cry of people reaching out to them, and they formed the Dr. Lorna Breen Heroes Foundation. And through this, held initiatives to raise advocacy, and they had a lot of support in order to create this initiative, and ultimately had a lot of federal support, and led with the initiative of having the Dr. Lorna Breen Healthcare Provider Protection Act.
Tell us a little more about this act, Jessica, in terms of what kind of changes that this act made.
Sure. So it's amazing because it called for $103 million of funding over 3 years in order to support the mental health of healthcare providers. And this was done through grants. And one of the biggest things that was really helpful to hear from Corey was how more needs to happen. They only were able to fund 45 hospitals out of almost 6,000 in this country. And that's less than 1% that needed funding. And so while it's amazing and grants take time, they will show change. And this is exactly what's needed, is that evidence-based change to have these interventions known. And so more hospitals can learn from each other as to how to make the environment better.
So Lorenzo, whenever hospitals and medical institutions, they address burnout, a lot of it focuses on improving clinician and healthcare worker resiliency. And, they have these resiliency training classes. Sometimes it's supplemented by some yoga classes and relaxation techniques.
Yes.
Are they enough?
No, absolutely, positively not. They are not enough, not even close to it. And one of the things that it starts at the organizational level. That's where the conversation has to start. And we want to honor our colleagues by acknowledging that another, if you will, mindfulness-based intervention, another resiliency class, and by the way, I'm all for those things, is not enough. We have to implement things at an organizational, as well as I would dare say a national level, which was touched upon in the article. But I agree with that completely, Kevin. The short and correct answer, absolutely not enough.
So Lorenzo, when you say that changes need to be implemented on a systemic level and an organization level, tell us a story. Give us an example. What does that mean?
What that means is, if we look at the COVID pandemic, we have, depending on what organization that you're in, your attrition rates in terms of healthcare professionals might have escalated from two to 3 times what you're normally used to. This is further going to exacerbate issues in regards to, if you will, administrative EMR burden. If you have less staff or resources, that is going to make things worse. If you did not have a solid foundational, if you will, health infrastructure in terms of supporting well-being, in terms of people's health care, self-care, things of that nature, that will further exacerbate things. And then going to what the Lorna Breen Foundation, part of what they look at, if people want to reach out and just even on that individual level get support, there are many things in terms of licensure, different credentialing practices that serve as barriers. So until we actually have a coherent system, the easiest way to say it, Kevin, is that you actually have to have clinician, healthcare provider well-being at the start of any new system or infrastructure. And hence, that's what the national plan is trying to get at. And in the article, we had mentioned or I should say, Corey had mentioned that the plan is there. It's just the steps in implementing it. But that system, unless you have that wraparound system approach, any of us in terms of our own individual resilience or what have you, it is going to be limited, beyond limited.
So, Lorenzo, you mentioned that you're a chief wellness officer at your medical institution. What's one way that you've moved the needle when it comes to clinician burnout?
Probably the biggest thing is, in my opinion, is actually having surveys and metrics that we follow that we're committed to actually implementing and doing something about. I want to give a big shout out to Dr. Rip at Mount Sinai Hospital, a couple of other people, and also the folks even though I think I met them once or twice, but at Mayo Clinic and all the work that they have done in terms of, I've referenced their articles quite a bit. But in order to do something, you have to actually measure it, and then you have to have buy-in from your organizational leaders on multiple levels in which to do something about it. I would say at GW, we are now using a Mayo model out of the novice stage. Other folks are much more advanced in it, but I personally also think we have to go beyond that. It has to be national level, because all of us interact or work together. So it's not just good enough for one hospital or one organization or one group to do it. We need at a high national level organization. And also, I dare say, just to toss it back to Jessica, we need different voices. We need the voices of different generations. And that's why she mentioned that we met on LinkedIn, but it was something about Jessica in terms of how, because normally, I mean, you get a lot of LinkedIn stuff, you're kind of like, oh, okay, but she had a certain passion to her. And I was like, wait a minute, hold it. This young clinician has something that I would love to support in terms of her getting it out there. So I just wanted to acknowledge that, Jessica. I've just been so pleased just watching you do this from my vantage point. I'm kind of a bit of an old head now, so I love to see that your generation really, and I think that's where a lot of these answers are going to come from. But yes, Kevin, at an organizational level, at the bare minimum, if you're not measuring it and committed to acting upon it, there's not going to be any change. That's probably one of the biggest things that I've been able to, along with our superb team here at the Resiliency and Wellbeing Center with my associate director, Lee Frey, we've been able to get some stuff done.
So, Jessica, tell me your ideal world in terms of the things that you would like to see done in order to combat burnout, suicide, mental health issues among healthcare professionals. And I'm going to ask the second part to that question. So once you articulate what your ideal world is, what are some of the obstacles that prevents us from getting there?
Those are great. And I'm also going to build off of what Lorenzo had said. So the first step is just the education, awareness, and acknowledgement. I wish I had known about this stuff in medical education or in pre-medical education. There's so much about the great healthcare provider exodus. You spend your whole life doing something I never expected to change careers. And it really comes down to fulfillment. And what are you doing every day? Does it have meaning to you? And so in terms of the other point, in terms of an ideal world and measuring, so with burnout, and I think the Mayo Clinic did the Wellbeing Index, and thanks to Dr. Tate Shenefeld and all of his work, and they talk about professional fulfillment. They have a Stanford WellMD model where it's culture of wellness, efficiency of practice, and personal resilience is just 1/3 of those domains. And how often are you in a healthcare environment where they're correlating burnout with provider quality and safety, and really correlating it with their own provider turnover to really see that, if someone's unhappy with the schedule or there's so many other barriers to flow, what is the incentive for changing? How do you get leadership to change it? And how do you bridge that gap? And so in an ideal world, you're asking about, in an ideal world, there would be that bridge between what's coming on from administration and what's actually going on in the front line. And you were asking earlier about, what does the fact that there is a physician wellness fellowship say about the healthcare system? It's about the fact that you need physician leaders, people who know what's going on, and there are more and more leaders coming up. More and more physicians are pursuing MBAs. More and more physicians are assuming C-suite positions because you need that intricate knowledge of that healthcare system to actually bridge the gaps.
And Jessica, what do you see as the biggest obstacles that's preventing us from getting to where you want to be?
You're in a system, you're expected to perform a certain way. In medical school and medical education, the curriculum is already so jammed with everything that you have to learn. There's really very little buffer. And it's not even buffer. Like where is the room for the important stuff? You go through medicine without learning how healthcare operates or about the business of medicine. So how can you learn about a system without understanding how it operates? So there's so many barriers in terms of logistics and structure and just the whole way our system is set up. But at least just to end on not a daunting note, things are changing.
So, Lorenzo, if we don't
Yes.
address this appropriately, tell us what's going to happen and frame it in terms of how is that going to affect patients if we don't address this issue appropriately.
Well, we're going to have more healthcare providers, unfortunately, with loss of life, first and foremost. Second, we're going to have a massive, and I feel comfortable saying this, a massive exodus of people who were invested in healthcare for a purpose, and they're going to leave the field, and that's going to affect who comes in and the quality of care that is given. And this is going to ultimately have an effect on patients in any number of realms, because if you will, the shortfall of healthcare providers has been well documented. This will only increase in addition to the increasing burden, or I would say burden, but challenges involving healthcare with an aging population. We've already know, if you will, child and adolescent suicide rates have increased, just to give a couple of different type of facts. So what you're going to do is you're going to be hit from both ends. You're going to have people that leave the healthcare environment, or they're going to do what's termed partially quit, which you will see a lot of. And then you're going to have an increasing health burden, and you're going to reach a crisis point, or another crisis point, in which you're ultimately, at some point in time, you might need to consider, if not already, some form of a radical system change, in which you just kind of retool the thing from the start, which, depending on who you talk to, some people say. But that's what I personally think that you will see. And I think actually we've been seeing this. We have been seeing, it's actually not what we're going to see. It's actually happening right now, this very moment. And I think if you talk to many healthcare providers, they tell you the same thing.
But are we seeing some of this burden already taking effect and impacting patient care at George Washington?
I would certainly say that in the DMV area, we absolutely are seeing, it is, all you have to do is look at how challenging it is to recruit healthcare providers, whether it's nurses, social workers, physicians. So everybody is doing their level-headed best to recover from COVID and keep doing what they're doing to give patient care. And by that, I mean everybody, my colleagues at different hospitals in the DMV region, DC, Maryland, Virginia, for those of you who aren't in DC. So everyone is doing that. But with that being said, the challenges are quite significant, because there's also the business aspect of healthcare. And people will tell you, if you speak to hospital CEOs, it is so challenging because the margins, quote unquote, are so tight in terms of keeping everything going. So yes, I would dare say that we are absolutely, COVID was a crisis point. We have navigated that, but we're still in crisis mode in trying to navigate how we come out of this and continue to serve patients across multiple systems.
I'm going to ask each of you now one last question, just your take-home messages to the Kevin MD audience. Jessica, why don't you go first?
In the big picture of life, this article is on suicide. The big take-home message is, no matter where you are, you're on your career path, no matter what else is going on, the first and foremost important is your well-being, your health, and your safety. And that's paramount to caring for others. And so there's so much out there now being done to try to address stigma. And even though it's still unfortunately such a part of our culture, there are confidential ways to seeking mental health access. And so the big take-home message is that change is happening, more is being spoken about. I think that was one of the silver linings of COVID, that now more of the stuff is being spoken about in the open. And so seek support whenever it's needed.
And Lorenzo, tell us some of your take-home messages to the Kevin MD audience.
Opportunity. This is an opportunity, depending on where you're at, to either advocate or to be part of the discussion at an organizational level in your system, whether it's your own private practice, whether you're part of a bigger organization, either academic, private, nonprofit. This is the opportunity. It is work, it is grinding, it is hard, but this is an opportunity that we haven't seen to actually make some significant change.
Jessica and Lorenzo, thank you so much for sharing your time and insight. Thanks again for coming on the show.
Thank you,
Kevin.